Hello, this is Dr. Ballantyne from Arc Valley Vision Care here in La Junta, Colorado. We are talking about dry eye today, specifically meibomian gland dysfunction. It's a very common thing. I have this problem too, so don't worry, you're not alone. But why do we get dry eyes? And right here, this blue part is the watery layer, which is produced by the lacrimal gland. You also have an oil layer on top produced by these oil glands. Here's a bigger picture of these oil glands. You can see we have a lot of them. They're called meibomian glands. They run throughout our eyelids. So when you have a good oil layer on top of your tear film like this, it's actually really nice because your tear film doesn't evaporate very quickly. When you get clogged oil glands like this person, you can tell that person's not going to have any oil on the surface of their tears and they're going to have issues. Here's a picture of someone with really healthy glands. You can tell when they blink, those droplets are going to transfer to the top layer of their tear film. And then some of these other pictures, you can tell those are getting clogged up. This is really bad. That's really bad. There's probably some small little bit of dysfunction with just anyone's glands, and we can always work on this. If you feel like you're always having to use artificial teardrops all the time, a few things that you can do that really help. So one is the AccuSoft foaming lid scrub. So we have these little AccuSoft scrub samples. This is a little lid wipe. So you're gonna open it up, it's like a wet wipe. You just close your eyes, you wipe the surface of your eyelid and eyelashes with it. When you do that, you're cleaning the area and you're cleaning it up so that your oil glands will function a lot better. This can be found at Walmart, but if you buy these all the time, it's gonna add up to a lot of money. That's why we have big bottles here. It comes in a big bottle that you pump the foam in your fingertips, you close your eyes, you scrub your lids and lashes with it, you splash it off with water. So keep one of those bottles in your shower and use it every time you shower. It only takes 10 seconds out of your day to clean your eyelids. Even people that wear makeup sometimes will use this to take off their makeup too. And it really helps to get those eyelids working better. Another thing you can do is a hot compress. So this is like a sample right here of like a heat mask. You can even just use a hot washcloth if you want to, but it's better to get a mask because it kind of works better and it's more convenient. But the whole idea is you want to put a heat pack on your closed eyelids. When you put that hot pack on there, I just lay down with the heat pack on my eyes for about 10 minutes. You want the heat as hot as you can stand it without burning your skin. And when you do that, you're actually melting down the oil. Then what you're gonna do is you're going to press. You can tell in some of these pictures, you can see where they're pressing, and I'll kind of, so you're gonna put your finger right there, kind of push up against the eyeball. So look up and then you're just pressing like this, and see where my finger is right close to where my lashes are. And see how I'm just pushing up against the eyeball and I'm moving over all the way across. And then for the top, you're gonna close your eyes and press right where that ridge is, that margin. You're gonna press a little bit all the way along the top. You don't have to press very hard because if you heated it up, you melted it down first. And then you're just going to gently express that oil. And think of it just like pushing up against the eyeball a little bit so that you're squeezing the eyelid between your finger and the eyeball. And so that's going to release a lot of oil. So if you do that every single day, that would be awesome as well. The other thing that you can use, now you have to check with your primary care doctor. If you're taking any kind of blood thinners, you don't want to do this without checking with your primary care doctor, but omega-3 fatty acid supplementation like fish oil pills is really good for this as well, because it will, it's good for your cholesterol, it's good for your joints, but it's also going to be good for your oils in your eyes because you're going to have better oil coming out every day. And so those are the three things: the hot compress with lid massage, the fish oil pills, and the eyelid scrub. Pick two of those three things, do them every day. The third one you can do every so often when you remember. Those are a couple things that will really do wonders for your dry eye problem. You don't have to even rely on artificial tears anymore because your tears will be that much better. The other thing is you can't just do them for a couple weeks and then stop, because then you go right back to where you were before. You have to keep doing these every day, just like building good habits. It'll take time, but once you build those habits, then you'll have a lot less dry eye symptoms. So give that a try and come see us. We have these products available in our office, and I'll even put a link in the description for a really great hot compress mask that you can buy from Amazon that plugs in. it's really slick because you get the same heat the whole time. It's awesome. So anyway, thanks for watching. Take care.